Vince here at my home studio because I am actually quarantined with COVID, and Dr. Patino in his office. We're going to discuss a little bit about what we've chatted about throughout the year, talk about Omicron, some other things, and the holidays. Just kind of just riff on stuff and catch up on our last show here before the end of the year. How are you doing today, Dr. Patino?
I'm doing well. I'm hoping to end the year without a positive test for COVID. I'm not very optimistic about that. You and I were chatting about this before, and first I have to say I'm very grateful that you're doing well. I know that you
Thank you.
tested positive, but you can honestly say you've survived COVID,
I am.
and but you survived COVID because you did all the right things, right?
Indeed, triple
Yeah.
vaccinated, did all the treatments, did everything I possibly could. An incredibly mild case. The week before, I actually lost a friend to COVID, so I've been very fortunate. And you're right. I think that's one of the messages we have to get out there to people. If you do the right thing, you might get it. I certainly did. It's not fun, but it's survivable. If you don't do the right things, it's a crapshoot what it's going to do to your body.
Exactly. And I was telling you before that I have a feeling, I've survived not being infected by the COVID virus since March of 2020 till now. Looking at the data on the Omicron variant, I think that this is going to infect a lot of people, just like we get infected with the uh, with the flu virus, right?
Mhm.
Even though we get vaccinated, we get the flu, we just don't get it too bad. um, but we have to remind those people who have chosen to not be vaccinated, those who have been vaccinated have chosen not to be getting the third dose, that this is the time to do it.
Mhm.
Okay, do it for yourself so you can, if you get infected with COVID, you don't end up in the hospital and you don't end up dead, right? So, because again, as a reminder, the reason we had the vaccine for COVID is not necessarily just to not get COVID, but to not get hospitalized and not need to be confronted with the possibility of death. Right? I was listening to some of the doctors from other states, Indiana, New Jersey, Rhode Island, where they're really having a bad crisis right now of not having
Yes.
beds in the ICUs, being very overwhelmed, and this is before Omicron, right? And I heard one of the doctors saying something very, very interesting, which is that he was saying that probably more than 90% of the people that have died from COVID in the last month in their ICU were not vaccinated.
Wow. That's
So that's pretty high. So you're like 14 times more likely to die from COVID if you're not vaccinated than if you are vaccinated, right? So the breakthrough infections, meaning people who are vaccinated getting infected, is becoming more common. I mean, one of my daughters in New York just became positive to COVID about a week and a half ago. Her boyfriend got positive for COVID. Obviously, they had basically a bad flu,
true.
a lot of runny nose, a scrappy throat, a mild fever, and they just managed it like the regular flu. And I think they took a couple of medications, Tamiflu or something like that. I'm not necessarily sure that that does anything for COVID, but they felt that they wanted to take something. But at the end, they survived it quite well without any serious complications, right? But becomes important that even those who are not vaccinated now, they need to take extra precautions. And the Christmas, the end of the year holidays are pretty dangerous in terms of exposure, right? So the rules we had with the original variant of COVID-19 and then Delta and so on, I think that the parameters of transmission were pretty much similar. It is looking right now that the parameters of transmission are a lot stronger. It's a lot easier for this virus to get transmitted, and it's happening so fast that we really haven't had much time to understand it completely. So I think it's important to take precautions.
Yeah, I know with my family and my wife's family, her father's frail. Me popping up with COVID, we've had some serious discussions about it, and those are people who don't do vaccinations as well, or really kind of deniers of the whole concept, starting to realize that, hey, this is real, and we have to be careful, especially if you can transmit it so easily. So going back to the social distancing, going back to the masks, going back to all the stuff we started with that stopped the initial spread of the disease, because as you mentioned, Omicron, so much it's not so much it's more potentially deadly. It's just that it spreads so much faster. And with everybody coming together at the holidays and not taking these precautions, it really is ripe for just an explosion after the new year of people getting to the hospital and being sick.
No, and I was also listening to some of the numbers in terms of how fast it's moving. Just to give you an example, 2.5 weeks ago, I was listening to the news and reviewing some data, and approximately Omicron was 3% of the total number of cases in the United States. Look again last week, it was about 14, 15%.
Mm,
Look this week, 73%,
wow.
displacing the Delta variant extremely fast. We're talking about 2.5 weeks. So that gives you an idea of the magnitude of the problem. And again, we mentioned this before. It's not just about you not getting sick, it's about hospitals being able to treat people and not
Mhm.
feeling overwhelmed because they have to utilize most of their ICU beds for patients with COVID 19. And if you do that, then if you have a trauma situation, a car accident that needs serious trauma care, if you have a patient who's having a heart attack, if you have somebody who needs um, an admission because he got a stroke, there may not be any beds for that. And it was sad to hear yesterday one of the University of Indiana physicians talking about his concern, right? That they were, as of yesterday, they were treating patients in offices being made
Wow.
as ICUs. They were treating patients in places that didn't have the equipment. So that increases the mortality of a lot of people, not only people with COVID, but people who don't have access to an appropriate level of care.
Yeah, I mean, taking up all those beds, taking up all those assets causes an issue. Let me ask you a question. We've gone through this now for quite some time. Um, we're still managing it. We're adapting to it, just as the virus changed. But in your experience, listening to the medical community in particular, what have we really learned?
Oh my God, that is the question, right? Um, I think we've learned some positives and a lot of negatives, right? Um, we have learned that COVID is here to stay. We have learned that we have to learn to live with COVID, and we have learned that we have to positively utilize the tools available to us from science, right? To um, to be able to manage it properly. Meaning, what does manage it properly means? Reduce the incidence and frequency of infections and reduce the level of hospitalizations and deaths. Right? We're not there yet. By far, we're not there yet. But we have better tools. This is not March of 2020. This is December of 2021. If you really think about it, in that span of time, we have learned a lot,
Mm,
right? And the only point of comparison we have was 1917, 18, 19, when approximately 22 million people died, right? So this time we have had approximately 5.5 million people die in the world, with a huge proportion of those patients being in the United States of America. So
which is
what else
crazy.
have yeah.
Which really
So
is crazy.
so what have we learned? We've learned that we made a lot of mistakes in the management of this pandemic, mostly motivated by political aims. We continue to lie to people about vaccines. We continue to lie to people about the risks associated with COVID, to the point that a lot of people are managing their fears by negating the existence of COVID, right?
I see that a lot. Definitely see it a
And
lot. It does literally does not exist to some people.
yeah, I mean, people will tell that I'm not afraid, it does not exist. And I mean, to the point that people at the end of their days in the ICU, they believe that this is a conspiracy and that somebody's making them die and it has nothing to do with the virus, right? Um, Now, fortunately, we're starting to see some response because of Omicron. For some people, kind of moving more toward the side of the vaccines. But the worst mistake we have made, and I think um, from a mental health and public health perspective, is that we have utilized the pandemic as a means that only has political and financial aims, right?
Mm.
I mean, sometimes I feel very frustrated when I listen to the news and I hear people talking about uh, why mandates are bad, right? When prior to 2020, we live with mandates all the time, right? I mean, there's certain things that you're mandated to do, and we've talked about those
Put your
in the
seatbelt
past.
on. A bunch of other stuff. Right.
Well, I mean, all the vaccines are required for your child to go to school, right?
Hmm.
Those are mandates.
Yeah.
But we took this into the political arena, and it becomes a flag, right? I'm a proudful non-vaccinated person that I'm representing a group of people. And that move into the arena of cultism, okay, and to stay away from utilizing the tools that are available to them. And that is not only sad, but one of the statistics I heard about recently was that because of their reluctance to the vaccines, from June till now, we have an excess of 150,000 deaths that could have been prevented.
That's sad.
Right now, part of the problem, Vince, is that these numbers are so astronomical. I don't think that we can understand the idea of 800,000 corpses, right? Of dead people. I mean, we become numbed to the numbers,
Absolutely.
and that is dangerous. And only the people who have actually lost a loved one to COVID can really understand the grief associated with that. So when we have a lot of people negating and with a lot of people refusing, right, they're actually negating the value of pain and grief of those who have lost a lot of people.
And that affects, I mean, all of our relationships, and especially going into the holiday season here. And we've always talked about the stresses of the holiday seasons with families and things like that. How is it? I mean, obviously, in particular, it's going to be affecting stuff. But how would one manage that a little bit better this year?
Well, I think the best advice I can give people is to listen more and talk less, right?
Mm.
Because um, something that I always go into a conversation, I can tell you happens in my family. Everybody's got an opinion, nobody's got facts, right? So their opinion becomes the fact, and then they insist and sometimes aggressively behave in a way that they're having to prove their opinion when they don't have facts, right? And the more you question them, the more aggressive they become. Because basically, you have to ask yourself, what is the purpose of this conversation?
Mm.
Now, as a psychiatrist, I mean, I'm naturally asked that question in my mind all the time. What is the purpose of us talking about this? Where's this is going? What are you trying to tell me? Right? And if I'm constantly challenging them, then I'm not going to be able to understand the purpose. Part of the problem, Vince, is that a lot of the people who are negating and refusing are aggressively defending their position because they're afraid, right? I mean, they're coming of a position of fear, and the only way they know to manage fear is defensively and aggressively, right? So the problem is that you if you keep challenging, it can get to the level of paranoia, right? that you're against me is not that you're against what I think. You're against me as a person, so you can belong in my space. And that's a very dangerous situation when you're in a family situation, especially when you have alcohol in the middle, right? Because alcohol removes inhibitions. So it becomes kind of unpredictable. So sometimes it's better to sit down and listen and hear and say, I understand, I hear you. That's it. Because the purpose is not to convince you that they're right, is that you convince them they're right.
Hmm. Okay.
Okay.
Well,
They
that sounds
they
like a good strategy going into any of these group settings. Don't be defensive. Understand that everybody is a little bit scared. Have some empathy. Listen empathetically. Don't judge, as you said. And even if someone's saying something that's kind of crazy to you, just say, okay, this is how they're getting through this right now.
Yeah, you see, what happens is if we start trying to impose a science on somebody who's already afraid and defensive, then it becomes their task to prove you wrong.
Mm,
And you and I have seen this all the time, and you heard people, but you haven't read the article that was written in Germany about this, or the article that was came out of Japan that says this particular thing, which is something that actually attorneys are very good at, which is splitting things into little
yep.
atoms, you know, and then kind of putting them back together to create their own reality. The problem that is that sometimes that reality becomes delusional, you know. So you get to the fringes of this is the government creating a chaos to have control over us and putting a vaccine in our bodies so they can track us for the rest of their lives, you know. um, like if government didn't have enough control and tracking ability before COVID, they've
Yeah.
always had it.
Yes.
So if people think that,
And quite frankly, better things to do. But
well, not only that, but you see, and I remember, you probably remember this, back in the 80s and 90s, when some of the uh, very libertarian radical people, I mean, like people in Texas, remember when they burned the compounds, those people wanted to go into isolation
mhm,
totally from the world by going into the wilderness, not using communications. Okay, keeping their environment uh, totally filtered from any outside influence, right? Until they made some mistakes, and I think it was in the Clinton administration when they uh, intervened in the camp,
yeah, Waco, the Branch
the
Davidians, and
Waco, yeah, all of that stuff. But now it's kind of like the opposite, right? Is utilizing the tools of media, okay, and actually the news as a way to maintaining control of the group, right?
mm,
And manipulating, sadly, for financial purposes.
mm,
You see, I mean, unfortunately, the more people watches your program, the more money
the
you
more money
make,
you make, that's right.
right? So it's very difficult to get yourself detoxified from that.
And fear sells. It used to be sex, but now fear sells. People want to feel, like I said, they have that insecurity. They want something to make themselves feel good. So to listen to a common viewpoint, somebody that's supporting their mindset, their behaviors, and everything, gives them a lot of comfort, which is odd because it's true manipulation. But um, that's really what's kind of going on out there. And when people go gather during our Christmas holidays, I think you're right. I think it's really important for everybody to be aware of why things are being said, not just what's being said, so that we can again listen a little bit more empathetically, maybe have some insight, not fight so much. Uh, this time of year has always been a challenge for people with mental health issues and with social issues, with family issues. You and I have talked about this many times in the past. What are other guidelines for the holidays, for people to survive the holidays in a much healthier manner?
Well, we have to understand and think positively. Most of us are going to survive the holidays, right? I mean, how scratched are we going to be? We don't know yet. But the only thing that we control is what we do. When we start getting into trying to control other people's behavior, okay, and we want to get into playing mind games, and in some instances, there's, I mean, there are family members that tend to be sadistic, you know, they really enjoy pushing your buttons, they really enjoy seeing you out of control, right? So, what we have to remind people is you only control you and you control your power, right? The moment that you start giving your power to somebody else, you're terribly vulnerable and things may not end up right. So you have to define your boundaries. You have to define your physical space. You have to decide if you want to be there or not. There's nothing wrong with standing up and walking out of a room
Mm.
and taking a break, right? So you don't need to prove to the world or to your family, your small environment, that you are it, okay? That you're better than they are or that you know more than they do. You see, we have forgotten the purpose of the holidays, whether you are Christian, Muslim, Jewish, Buddhist. I mean, it doesn't really matter, right? The purpose of the holidays is a spiritual, right? Is not to get drunk, is not to get high, is not to prove a point, okay? But we have forgotten that our purpose is to be at peace with ourselves, okay? Not to make peace for everybody else. Because our best contribution to peace is us being at peace. Us not needing to let the world know how powerful we are, or how aggressive we are, or how we don't take it from anybody, you know. And if you walk into my space, I'm going to show you, right? Because you get back to the same issue of purpose. What are we trying to accomplish, right? And basically, what we're trying to accomplish is that we stay alive and
We're
that we
actually,
can.
quite literally celebrating the. We just, I think today is the winter solstice or close to.
Mhm.
We're halfway around the world, the Earth, our orbit. It's dark, it's cold, and guess what? Now we're going to come back out of it. We're coming through it.
Yes, because hope dies last, right? But one of the problems we're having with all of this, especially with younger generations, is a lot of hopelessness, right? I mean, I can't tell you how many people I've seen over the last year that come and ask me, what is the purpose?
Hmm.
I mean,
Interesting.
that's a lot of young people, you know? I mean, this is a mess. What am I here for? And I have to kind of work with them on understanding that the purpose that has been sold to them is not a real purpose.
Hmm.
Meaning, the purpose is to be successful. The purpose is to have money. The purpose is to have as many relationships as I can. The purpose is the one who gets the most likes win. You know, those are not purposes, those are actions. Those are things we do. Our purpose is directed by our values, right? So our purpose is, as we've talked before, to transfer information from one generation to the other, and the generation that's coming behind us needs to get at least the same values we got, right? But we're not passing values. Now we're just passing information.
Hmm.
And we
Interesting.
need to pass values biologically, psychologically, socially. And our purpose should be to give the next generation good enough tools so they can succeed at one, keeping themselves alive, okay? And second, to be content with themselves. But when we start looking at values only based on the external recognition we get from our accomplishments, that's pretty empty. So you see, the basic idea that you're a valuable human being because you have good values, people, kids have trouble understanding nowadays.
Hmm. It's all about superficiality, their earning potential, the items that they have, instead of the value unto itself. When you said, what is the purpose? I had a younger person ask me that recently. I said to do the best you can every day
Hmm.
to make a difference. And they said, difference in what? I said, what does it matter? Does it matter if it's a difference in you, a difference in another person, difference in your family, a dog, the condition of your house? I said, just that's the point, I think, of the effort. And they said, but to what end? I'm like, so that you can die peacefully. And they kind of looked at me funny. They really didn't understand that.
Yeah, I remember recently I stopped uh, by a traffic light. There was this older person, excuse me, that he was obviously mentally ill, you know, standing in a corner asking for money, right? And so I opened the window and I gave him some money. And somebody was in the car with me and asked, "Why do you give him money? Don't you know that he's going to spend it on drugs or cigarettes or alcohol or whatever, right?" And the only thing that I could say is one word, and it's called compassion, right? I don't control what he does, but I control what I do. Okay. And if I feel compassionate, I'll feel compassionate. And that's it. I don't have to rationalize to the ultimate detail every single action that I complete. And sometimes people get upset with me because and instead of saying compassion, I could have said because I felt like it. But if you say that, it's not good enough.
Hmm.
It's like uh, what I felt from that other person's perspective was wrong. So sometimes we have to let people know what values drive us to do what we do, right? I mean, I can't sit down and worry for the next hour about what that person is going to do with the money I gave him. That's not why I gave him the money. I mean, if I wanted him to eat, I would have gone to McDonald's and buy him a hamburger and give him a hamburger. I gave him money, but I gave him because of compassion, right? And then if I say because I feel like it, the other person can would have said something like, "Well, they're fooling you," right? But you see, when you're doing it for compassion,
Doesn't matter.
no, I can be fooled because it's not about them; it's about me, right? So extending a hand and asking someone in dinner who's out of control, just listen to them and say, "How can I help?" You know.
You
So
know,
we
most
have we have
okay.
forgotten compassion and empathy.
I was about to say, most of this year we've used that word a lot, empathy,
Mhm.
and maybe this is very fitting that our last show of the year we've moved to a new word, and that new word is compassion. And understanding how to apply that over the holidays, practice it a little bit as we get into the new year, because these stressors are going to continue. They're not going away. And maybe now that we have had a little, let's move to the next level. A little bit of compassion. Instead of arguing with people, instead of trying to be so selfish, and see where we can take that word in this next year.
I really agree with that, and I think that we need to focus a lot on uh, the mixture of compassion and empathy. Meaning, put yourself in other people's shoes.
Mm.
So when you have somebody in front of you who's arguing in the Christmas dinner with you about vaccines, right? Uh, Put yourself in that person's shoes. Try to feel their fear, right? So you can have some compassion, and you can provide some handout. Here I am. I'm not your enemy because
So,
I don't think that we're going to be able to bridge that divide that we have gotten ourselves into without compassion and empathy.
well, maybe that's the big gift this year, right? Instead of trying to get something or take something, what can we give? What can we give? And given that compassion, look at the person across the table from you or across the aisle, wherever, and make that our focus. over the next couple days, and especially during this weekend. Doctor, I just want to thank you for a pretty wonderful year.
Yeah, we have a good year. There's better things to come. I think that we're moving forward in the right direction, and I think that we're going to be coming out with some new ideas, some new products next year. We'll probably hopefully start getting into publishing a little more.
Would be nice.
So you have a great holiday with your family and yourself, and I hope that you keep yourself in check in terms of this COVID thing. And congratulations for surviving it.
Absolutely, and thank you very much. We'll see you all next year.
Thank you. Take care.
Take care.